Hello, everybody. We're back with another researcher to talk about the 4-day school week and the research that they have done on the topic to help us, those of us that implement the 4-day week or maybe are considering it, do it better if we do it. And so today, joining us today is Dr. Emily Tomayko from Montana State University. And then from our partnering Missouri school districts joining us, we've got Dr. Dustin Storm from Miller School Districts, and we've got Dr. Allison Murphy Pope from the Hurley School District. And so they'll be joining me with questions for Dr. Tomayko. And so Dr. Emily Tomayko, thank you for joining us here in Missouri, those of us that work in the 4-day school week. I got a question for you. How does a person whose background in nutrition sciences and dietetics get into the 4-day school week? How did you even get down this path?
That is a great question. Definitely not something I would have said I would get into when I was starting out. As you mentioned, my background is all nutrition, nutritional sciences. And really, how we came to the 4-day school week was thinking about the role that schools play in health behaviors for young children. So I work with a couple other health-minded researchers, Dr. Kathy Gunter and Dr. John Shuna, who, along with Dr. Paul Thompson, form our core team that are working on the 4-day school week right now. And Doctors Gunter and Shuna are physical activity experts, so that's their realm. And we had just been having conversations about the school environment and really what it affords children in terms of, school meal participation, norms around eating, physical activity opportunities, physical education. So all of these things. John and Kathy had been doing some work around physical education policy in Oregon specifically. And we had been following, really, this is where it kind of came to a head, was following some work looking at health behaviors and weight status of children over the summer. So there seems to be this almost a health loss that happens over the summer with children, where you're seeing increases in weight gain and changes in weight status for children that's happening over the summer when they're not being exposed to that school environment. So we were thinking about that. We became aware that, Oregon is one of the states that has the highest use of 4-day school week. So we started thinking, given what we see over the summer, what happens when you have this perpetual 3-day weekend as it is, or is that even really what it is? And of course, now that we've gotten into that, it's become very evident that it's a lot more nuanced in terms of what's happening with families. But that was really how we came into it, was that thinking about the school environment, how that supports nutrition, how that supports physical activity. And then when that shifts from something that's been traditionally used or historically used, like the 5-day school week, how does that impact those spheres of health?
And I know that you've done a number of studies on this. And again, I'll link when we put up this video, I'll link back to your website where people can look more at the work that you've done. But go through and talk us through that again. So what are you finding about the 4-day school week that's unique as compared to the 5-day school week?
So one of the things I think that's really stood out to me on this issue of physical education is we started looking in Oregon. So just to give a little bit of context to the work that we've been doing over the past 5 or 6 years, we've been doing a lot of secondary data analysis, so taking existing data sets, given that when we started, there was not a large body of research on 4-day school week use. I'm excited to see that interest in the research side of this has really increased, and that conversations like this are happening as we bring research and practice closer together. So we started with existing data and wanted to focus in on those behaviors that I mentioned. So looking at physical activity, looking at health behaviors, I'll mention that one in a little bit. But we also had a lot of data on actual physical education delivered in the state of Oregon. And combining that with our database of 4-day school week use in Oregon, we were able to determine that 4-day schools were actually offering more minutes of physical education compared to 5-day schools. So this was in terms of absolute number, minutes of physical education, but also relative to the time in school. Because we know that on the whole, the time in school, the number of minutes is reduced in 4-day schools. So that was a really interesting finding to us, and something that certainly wasn't expected. We used another data set, the Oregon Healthy Teens, which is really similar to the Youth Risk Behavior Survey that's administered mostly nationally. There's a few states like Oregon who participate in a slightly different way. that looked at a wide range of health and risk behaviors, but specific to that PE question, it was interesting because um, adolescents who self-report on this survey, so 8th and 11th graders, were reporting fewer days of physical education. And I think that makes sense, right? There's one fewer day of school per week, but so it was really interesting to us to find that the minutes of physical education were actually being preserved. And when we looked nationally at some national data or more nationally representative data, that was actually maintained. So this idea that physical education is being reduced, the number of days that it's offered is, and that again, like I said, that makes sense, but somehow districts are able to maintain and even offer increased physical education. And the same goes for recess as well. So minutes of recess also are increased in 4-day schools relative to 5-day schools. So that was something that really stuck out and something that we are hoping to explore. I think in terms of research, we're really just getting going with some of these questions, and there's so much that we have to learn. What are people, how are they doing this? How are they staffing their physical education classes? How does that look across districts? What is the physical activity that's associated with that? Is it actually related to an increase in physical activity? So we know the minutes are there, but what are they actually doing? And just continuing to follow that thread, physical activity levels, does that have any benefits into health outcomes like weight status or other outcomes of interest for children? So that's something that I think was surprising to us. A lot of things have been surprising in this research, but that was one that in particular we want to follow through.
Okay, so just so again, and if I'm wrong on this, straighten me out. So just to paraphrase, is that maybe your expectation was is there's going to be less time in recess and PE classes, but you're finding, at least in Oregon, is that that was not the case, right?
So yeah, Oregon and other 4-day schools across, I don't want to say nationally because as you all know, it's not fully utilized across the country, although that might change given the trends that we've seen. But in 4-day schools, more broadly speaking, that physical education and recess time are preserved or increased.
Dr. Storm, Dr. Murphy Pope, tell me, when you both were superintendents and you made the transition to the 4-day week, how did it impact recess, for example?
For us, you look at secondary physical education. We have a daily 7 through 12, and our hours actually, we didn't cut hours when we went to the 4-day week. We extended our day. And you look at the PE, for example. I mean, if you're having PE 5 days a week, lots of times kids are dressing out, and it's taking them quite a bit of time to get dressed out and go. In a 4-day week, that PE time is actually a little longer for that class, so they're not spending as much time getting dressed in things, and they're actually more activity there. And I think one of the things too, it might be I've been, this is my 23rd year as an administrator. I have an elementary background. I look back when I first started in as an elementary principal. I think we did a disservice to recess back 20 years ago. It was like, hey, we need, obviously academics are very important, but we want to make sure these kids are in this classroom learning nonstop. And we want to, and the trend is not to have much recess because that's cutting away from instructional time. But obviously through research, and we learned, recess and play is so important for our kids, and that really helps out in the classroom. So, our trend is probably we look to have, we want to make sure kids have that morning recess and afternoon recess in a 4-day week because they're in school longer. So I'm not horribly surprised by that from my perspective, because I see that trend here in our school. So I don't know if the reason is because the trend of recess has become more important to people compared to what it was 20 years ago, if that's the reason why, but it could be.
I'm so glad to hear you say that. Just, and that's another thing I've really appreciated about this work is just how all of these factors are related and all of the things that the school environment means to kids. We talk a lot about academics. I know you talked with Dr. Thompson about that, just how those are related. And I don't know that we've come full circle on that. I'm so glad to hear you say that. But of course, when kids have had a chance to run around and, get that physical activity, it does improve behavior. It does improve learning. All of those things fall into place. But when you're sitting down and having to make those choices with reduced minutes overall, on paper, it can be really difficult to make those choices and actually trust that that's going to play out in a positive way.
Well, and I think in Missouri too, we're unique with us. I would say very few schools cut instructional time because of the 4-day school week. Our instructional time stayed pretty much the same. Some maybe even increased a little bit, some decreased a little bit, but overall, with the hours of instruction, this because you're doing a 4-day school week in Missouri, your hours of instruction are pretty similar to the 5-day school week, in what I've seen anyway.
Mm-hmm.
Dr. Murphy Pope, anything?
Yes, actually, I would agree wholeheartedly on the high school side. That functions similar, that you have more time that you're actually working out. But the advantage too for us on the high school side is because we're small, is our kids all participate in everything. There's not ever anything that holds you back. On the elementary and junior high side, we have prioritized recess and PE. And actually on the elementary, they actually get PE more than once a week, because we built in a data time, and I used my specialist teachers to do some additional collaboration with teachers. And the biggest reason I would say is about 10 years ago, I started reading some studies that had to do with brain breaks and academic performance after transitions. And a lot of it was on the secondary side. It was the idea that if you go to an English class and then afterwards you take an elective and then you go back to a math class and then you go back to an elective, that your performance in those core areas that may not be of interest to you, your performance is better. And so when we came back into this, that's kind of been an area where I've looked at. Elementary teachers always did a really nice job of occasionally standing up and getting kids up and moving a little bit. And so in my mind, I call that a brain break. But for me, that's where PE and recess are valuable, because you want that engagement back in, because, well, you like the physical activity because that's important for their health, but it also has a positive impact on their learning environment. So for us, that hasn't changed at all. And then when you talk about on the food side, with the Monday, I haven't seen a big difference or a big change since I've been here, with them not being fed on Mondays. But for some of us in the small towns, we have various programs where our kids are able to go for childcare that partner with Boys and Girls Clubs or YMCAs. And there's a lot of extra physical activity that happens on that day for your littles. I can't say that happens necessarily for your teenagers. They might be device driven on Mondays. But we've always prioritized that. I think that's part of being a healthy human. There has to be that activity because those are lifestyle choices, and you're trying to impact their lifestyle for the rest of their life rather than just while they're in high school.
Well, I'm going to kind of jump into it. I think we think about soft skills. Our kids, unfortunately, they haven't grown up like we all grew up. I mean, I like Dr. Turner and I, we lived 2 blocks away from each other. We were all over town, and that's just what we did. I mean, and that was how we grew up. And nowadays kids, they got the device in their hands at all times. And, you learn a lot through play. You learn a lot through those activities. And I think our kids probably need recess more than ever now to learn those soft skills, how to communicate, how to conflict resolution, all those different things that happen on the playground, as we all know, because we used to learn those things just in our neighborhoods. And I can't say that I don't think that's happened as much as it used to anyway, learning through play in the neighborhood.
Yeah, that sandbox time is really important.
Being the oldest person on this call, Dr. Storm and I, I'm sure, went to the same elementary school, Eugene Field Elementary School, and I'm still in contact with my 2nd grade teacher. Okay. And she and I were talking about recess one time. We got 3 recesses when I was a kid. The morning and afternoon recess were 30 minutes apiece, and sometimes the noon recess went up to 45. So you do the math on that. Yeah. We were over an hour and a half of recess a day in elementary school back when I was a kid. And you don't get that. You don't get that anymore.
I remember it. That's why I love school so much.
Well, there's some purposefulness there. As I coach my son's ball teams, and I can tell you they listen a lot better when they're learning plays and stuff when they're absolutely exhausted. So I'm guessing, John, that she was trying to wear you out so that the academic focus would come back.
Well, and again, it's another thing just to think about is one of the things when I talked to 4-day school week saying, you know, and like we said, Emily, it's different in Oregon, but in Missouri, when you transition to the 4-day week, you have to maintain the same number of hours. So in most school districts, they make the day longer. And one of the things most districts do is they add back in a recess, you know, that some of that is baked into the cake in Missouri, which might not be in other states when they may actually reduce the number of hours that kids are on campus. But in Missouri, we're still there the same amount of time, just on 4 days. And one of the strategies that many you do use is adding back in a recess that had disappeared sometime in the past. So, Dr.
But I think
Tomayko,
that's so important to schools that are thinking about adopting it that might have a different policy context. And I think that's where a lot of this nuance is still to be determined, really, because every state is different, every community is different. I think there are some common factors across particularly rural communities, just in how important the school is to the community. And I know you all know that very well, and people who are listening to this likely know that too. But just thinking about what is it about the way that you've done it that has been successful? Maybe it was by necessity that they've added in that extra recess, because you have to maintain those number of hours. But can we learn something from that we could then apply to other places that maybe aren't doing that? Maybe they are reducing the minutes, but or if you are seeing some benefits to that. And those are the things that we are really interested to explore a little bit more systematically, so we can say something about that. So like I said, what we know is that there is more PE, there is more recess. Hearing about why this might be happening in Missouri and unpacking what's going on in these other places, I think will just get us closer to some of these best practices.
Dr. Tomayko, we want you to be the star here. So again, lead us down the path a little farther. You said there were lots of surprising things from your research about the 4-day week. What are some other things that you found that were aha moments?
Well, I just think, I'll be honest, when we first got into this thinking from, the school meal perspective, for example, or physical activity, I think we were on a little bit more on one side, hypothesizing that this would be a challenge for families or more of a struggle. And I've been surprised at what we're seeing so far in terms of either no differences in some of these behaviors or a lot of positives that we've uncovered. So I think I really come a long way in understanding really what this means. And like I said, there's still, of course, a lot of questions. And one of the things I do want to be careful about is thinking about the equity piece. So where I'm sitting right now, actually at Montana State University, is in the Center for American Indian and Rural Health Equity. So I've been affiliated with that center. I do a lot of work with Indigenous communities as well on some other projects. But thinking about that health equity piece, and that could mean broadly in terms of rural versus, urban, suburban. But, I know Dr. Turner, in your work too, you've thought about this, the families or groups of people for whom this might not be the most optimal situation. And so while we are seeing a lot of positives, I think I don't want to completely let go of this idea that there might be people for whom this is a struggle or this is a challenge. I know in your work, you've mentioned children with special educational needs or special health care needs being a population, or families with young children. But I think what's really missing is the long-term look at things from a research perspective. So we're getting these snapshots, we're getting these really interesting looks into the different contexts. We're starting to unpack that, but looking at some of these things long-term over time, particularly as new states, new districts come on board to understand, maybe what are some of the things to be looking at down the road in terms of health impacts. And so, I think, you asked about things we were surprised about. I think just the benefits that have come up, we've gotten just so much positive feedback. But I don't want to lose that thread of understanding the people for whom this may be challenging.
Sure.
Things like, food security and childcare, that's been addressed a lot. And I just want to make sure that we're really reaching those populations and those groups to understand their experiences, or maybe what they did to mitigate the challenges that they were experiencing. Because I think there's a lot to be learned there.
Well, and I think all of us that have looked at this for some period of time, and I include Dr. Storm and Dr. Murphy Pope in this, that we've looked at this for a long time now. We're not new to this thing. Is I think many of us have this understanding that there are kids in our community that their time at school is the best part of their week. As far as people that care about them, safety and security. I know I've got a meal there. If somebody picks on me, I've got somebody that's got my back. It's that kind of that time that they're at school. And there is, I think many of us have this uncomfort of that 3-day weekend. And again, this is a tiny minority of our students, but there are kids that are missing out not being around people that really love them as much as as the adults that work at a school 5 days a week. And so that's something that's really interesting to me. And of course, you pointed out that I have a strong concern for kids that have chronic medical conditions. And, that school nurse is vital to that family on supporting that kid and not having that nurse available on that 5th day, or kids that have a behavioral issue where childcare may be available. But if I've got a kid with autism, childcare may not be available with a child for autism. Or again, those unique family setups, like you said, families that only have a kindergartner and a 1st grade. If I've got a 1st grader and a junior in high school, we can sort of work out childcare within house. But if I've only got a kindergartner or 1st grader, then that childcare issue can be a financial issue or a challenge of even finding it. So again, I'm with you, is that it may only be 15% of our school population, but their voice needs to be heard too. Dustin and Allison, got anything? Yeah, go ahead, Emily too.
I'd like to add something. I apologize. Go ahead.
No, it's okay. I just wanted to add something quickly, that I think a lot about how the family and the school and the broader community interact. And anytime there's a shift, where are things moving? So you think about the cost savings, is that being passed on to families? Another long-term impacts, and this isn't my area of work, but I just think about, mothers in particular and their decisions around working, and what are the long-term impacts of that. We heard a lot at the conference we were at together, John, about how families figure it out, and I'm just curious and just want to keep that on the radar of everyone. Like, let's make sure we're following some of these things over time, all of these things. So the health behaviors, the health impacts, the sleep patterns, the eating patterns, physical activity, health outcomes, how that all tracks throughout a child's life and a family's life.
When we first went to the 4-day week, one of the things that we offered was Mondays. Bring your kid here on Monday, and we were going to rotate staff members on. Nobody showed. And I had heard from other districts, they figure it out, they work it out, all those pieces. And there's zero industry in Hurley. Unless you're a farmer, you have to drive 40 minutes to go to work. So we knew hours wise, sometimes school hours weren't conducive to that. There's not a child care center in Hurley or any of that. And it's ironic that all of that kind of somehow resolved itself. I don't know whether there was a lot more people sharing kids on some of those. And I had a lot of families who were already working 4-day weeks. They were working 10 hours. And then I had a lot of nurses and working 36-hour shifts that considered full time. Well, then when we started doing our surveys annually of our community of needs, we had an expression that our needs had changed. And so we had some individuals who said they needed some assistance with childcare on Mondays and after school. So now we partnered, and I only have 7 kids. That's it, 7 kids out of all those kids that needed assistance. So it's not cost effective to do it here. So I'm taking those kids to another school district next to me that has an after school program till 7, and then on Mondays, and it's $30 a year for families. So it's really, we're receptive to what our community is telling us. And then if we get to a point where they say, we do not need this anymore, then we won't bust them over there anymore. But I think that's the part in this, as schools look at making those changes, is how do you go back and revisit those conversations with your patrons, because their needs do change, their jobs do change. And then how do we meet those needs? Because I think everybody in the school setting, you want what's best for kids. You worry about kids. You worry about whether they're hungry or whether they're safe at home. And I think the piece about this is keeping your eyes open to see what those needs are. And I can't describe it. I don't know how they resolved it. It's just, we were here on Mondays and nobody ever came. And then same thing on late starts for snow days. I don't know that this is connected necessarily to 4 days, but I heard lots of complaints of a neighboring school district that had a late start. And so when we decided to do a late start, because sometimes there's a difference in snow just once the sun comes up, it melts enough you can get kids to school. but some families needed to go to work. So we opened up buildings, drop them off, we're here. Nobody comes. So it's kind of interesting to watch through that process, because I would love for them to tell me how they figured all that out.
And I really appreciate you mentioning the dynamic nature, within districts, but also 4 days just across the board. I think it's changing, and just keeping our eyes open. And I guess my whole platform really is just keeping health in the mix of that conversation. And when districts do consider this, and we were talking before about coming down on one side or the other about this. I don't think I'm about that at all. It's really, what are the things to consider if you are wanting to adopt this, or you have adopted this? Have you thought about food provision? Have you thought? And most places have. And so we are from a research perspective trying to understand that, like, how did this happen? Because we weren't expecting that. How are you making this work? How are families making this work? And does that change? And if it does, do families feel empowered or enabled to raise that? If everyone else is so jazzed about this schedule and is loving it, what is that dynamic like in your communities?
I want to
No,
kind
and-
of
Go ahead, Dustin.
I
No,
was
you
gonna
went.
say, one thing with food security, most schools have the backpack program. I know that we participate in that too, and we know our kids, we know our families, and so we definitely want to take care of them over the weekend, and we've had that in place, and that's been successful. One of the things too, also in Missouri, we have summer school in Missouri. Most of the schools in Missouri are going to go to school 11 months out of the year. I mean, July, we're off in July, but we start school in August. We go until end of May. We take a day off. We go summer school to end of June, basically. So we almost have a year-round school in a sense for those who want to participate. And then back to like the child care. One of the things that's interesting, that I was told from several people in our community, we went to 4-day school week. Traditionally on a school, you get out of school at 3:00, so to speak, and a parent might not get out home till 5. Well, our bus routes are pretty long, so typically a kid will get out 6:45 and not get home till about 5:00 at night. And so they're like, instead of having to find someone for an hour to watch my kids, this worked out perfectly for us. And it's a lot easier to find childcare for one day than an hour for 5 days a week, so to speak. And so that was something I was not expecting to hear, but actually it worked for a lot of families, worked better this way, if that makes any sense.
Can I speak to the food provision aspect? Because I just wanted to give a little plug. That's something that we're actively working on through 2 mechanisms. One is, like I mentioned before, doing some of that secondary data analysis, looking at food security data at the school district level. So that's something that we are working on right now, but also some primary data collection of surveys of districts around what they're doing for food provision. And something that we are exploring, similar to what RAND has done through their work, but just trying to understand through focus groups what people are doing. And similar to what you said, Dr. Storm, families everybody knows each other, and people know the families who are struggling. And so we're hearing about these ways that the school community is coming together to support those people. So it's even less formal sometimes than the backpack programs you mentioned. Sometimes it's coaches bringing snacks to practice because they know that, a handful of their players are struggling, and kind of making up the difference there. But that was something we were thinking about too, from a health perspective, just looking at the whole day. How does this change? You mentioned the longer days or the longer commutes and some of these rural specific factors. How does that play into snacking, sleeping? We're hearing a little bit from families and focus groups about their little ones falling asleep on the bus, and what are the effects of that when, you go home and try to put them down for bedtime. There's so many factors at play. And I think we're just starting to unpack what that looks like on the school day, but also at home, so we're still trying to figure out does that 5th day look more like a weekday in terms of meal times and sleep schedules. And, as I mentioned, RAND has done some really beautiful work on this too. But just looking at that to see how that really plays into the whole week, and just, patterns overall, and what that looks like for kids and families.
I think there's so many areas, even like you were talking there. I think in fact, today I got a call from a superintendent in Kansas, and he was wanting to know, why is everybody in Missouri on Monday off instead of Friday off? And so we sort of talked about it and things like that. And I think there's something there. I mean, one of the things I constantly tell people about Monday off is the superintendent out at Bakersfield one time told me, he said, the reason they picked Monday instead of Friday is, he said, if we'd have picked Friday off, he says, if we're doing PD on Friday, everybody's just going to be talking about what they're doing on the weekend. If we're doing PD on Monday, hopefully we'll be talking about what we're going to do in class tomorrow, and so that was sort of their reason for it. But I can think about it within the student realm too, is that I just know in my kids, is that if we know we're not going to school tomorrow, I tend to let them stay up later, and they sleep in a little later. And, and those kind of things, does that dynamic change on a Friday as compared to a Monday, as far as that sleep schedule pattern, how many hours? And so I think there might be something that may impact learning there if we aren't careful about that. But that's more of a communication with parents. But again, understanding how that might impact it. And I also appreciate your point about talking about how this is, while we always know, or at least in Missouri, we talk about they'll find a way, they'll work their way, work this childcare issue out. But like you mentioned, Emily, is that if a mother is a single mom and she's got her kids and she's having to take that day off and lose 20% of her income because she's now childcare for her kids. I know they're not childcare, she's taking care of her own kids. But the point is that there can be negative impacts on families to the extent of if one of the parents has to stay home to be with the kids and they would lose 20% of their family income, for example, that is something that really needs to be investigated. And it's not something I think anybody's looked at yet. So, yeah.
It's not inconsequential. And, just in my evolution of thinking about this, we're learning about that increased family time. And, people tend to focus on one outcome or another. Maybe it's academics. Like I said, I came into this from a health perspective, but because of all that the school environment means to kids and families and communities, I think we have to consider all of it on the whole. It's a balance, right? So maybe there are some achievement impacts, and it does the increase in family time maybe counterbalance some of that. Does it help some kids and not others? Because some kids are home with their family and they're reading and taking cool trips and doing this really enriching activities, and other kids are not. So lots to try to understand. I love your idea about the, looking at the Monday versus Friday, because that makes me think of this whole aspect of things like medical appointments and dental appointments and healthcare access. And I know you mentioned barber shops, but just this idea of people using that day for other things and how that might support health as well. And some of those differences in, Monday versus Friday, I think would be really fascinating to explore.
Okay, now Dr. Storm and Dr. Allison Murphy Pope, I'm gonna have Emily wrap up here in a second, but do you have any questions either of you want to ask her about these issues? Are you good?
I don't know that it connects to 4-day week, but it would be awesome to really look at the dietary requirements and whether or not they're really as healthy as they claim they are, considering what we're giving kids. I mean, there's a lot of things when we look at our own diets and how we maintain our weight. And sometimes I feel like this incredible desire to reduce sugar, obviously it's changed how we've given milk to kids and taken away the whole milk. And there's just a lot of pieces when I look at a school lunch, or I look at some of those dietary things, or even some of the things we've had conversations about that we've sent home in the backpack program. Is there any work along that, or is that just too far outside the 4-day week possibility?
In terms of revising school lunch standards?
I mean, is there any conversation about, because you were talking about, and maybe this is what you meant, is that maybe the food they're eating at home is so poor by having that third day at home, or as it relates to the 4-day week. Is that what you were talking about earlier when we first started on the dietary?
It could be. Yeah, it could. I was actually more thinking from a food security perspective. I don't know exactly what you're referring to that I mentioned, but just having the access to the meals, and Dr. Turner, you had mentioned for some kids that is their most stable access. So I think for some kids it is the best thing. Do I think there are changes that would be beneficial to the school meal program? Yes. I think it's going to be really challenging. I mean, they revised them, what was it, back in 2012? And childcare standards have lagged even farther behind. There's so much I think we can do. And I think a lot about, there was a report that came out in 2012, I think, by what was then the Institute of Medicine on accelerating progress in obesity prevention. And one of their key takeaways was strengthening schools as the heart of health. So just that idea of the critical role that schools can play. And I think the school meal program, I mean, we might schedule a whole nother conversation for that in terms of what it does and what it provides, and has it improved since the changes? Are kids actually eating it? There's a lot there to unpack. I don't think we've dug into that quite so specifically. We're more thinking from a food access and food security standpoint right now. Because I think it's going to look different, kind of depending on where kids are and what their home environment looks like, which is why I mentioned that intersection between the family home environment and the school environment, on all of those things, like on eating behaviors, on food access, on what foods are actually being served, on sleep, on physical, all of those things. It's not just a school in isolation. It's not just the family home in isolation. It is very interconnected, and especially in smaller communities where a lot of those things do happen at the school, where the schools are open for families to come and be physically active on weekends, even just all sorts of things that play into those health behaviors, and seeing how that tracks over a lifetime too. But we do know that school meal participation is eligibility is higher in rural areas and in 4-day school weeks in particular. So it's something we want to keep an eye on. But to the level of detail in terms of the nutritional quality of those, we haven't really considered it in the context of the 4-day school week.
You also earlier alluded to students self-reporting on a survey. Was there anything in regard, did students say they were more sedentary on the day that was home, or what types of questions were you asking on that student survey? And I asked that because, is there something that we should be asking our kids to give us feedback on? That way we can make sure that we're addressing any of those needs.
Yeah, it's a great question. So it was the Oregon Healthy Teen Survey, which was not collected for any sort of 4-day school week purposes, but it did include enough 4-day school week students that we were able to apply our research question to that. That was where we saw the fewer days of PE, which again, that requires some context. There was higher self-reported food insecurity among 4-day students. So 4-day adolescents reported greater food insecurity than their 5-day counterparts. We saw some changes in things like sugar sweetened beverage consumption. There was also a really similar study done in Colorado that looked at the analogous survey, the YRBS, which is what most states use, and saw some similar things where there were some positives, some negatives, like related to breakfast consumption. This survey also looks at drug use. So the things that you mentioned at the very beginning about, I can't remember if this was before we were recording or not, but about teen pregnancy and risk behaviors, and we did see some differences there. I do, again, as a scientist, want to qualify everything, and I think we don't really understand the context of that. And that was in Oregon, but it was things like higher marijuana use, drug use overall, and marijuana use specifically among 4-day students. I think that needs more context to really understand what's happening. And I think it's different everywhere. And that's why I feel good about my job security, in the sense that there's a lot of questions we still want to answer, thinking about the policy context in a state, and that could be broadly speaking in terms of number of minutes you're required, or it could be specific to physical education policy, which is again where we started with this whole thing in Oregon. And just really trying to unpack all of that, see what people are doing. How are you making it work? How is this family making it work? What can we learn so we can make this better for everyone? Because I guess in closing, I'll say what I really have taken away from this work is this idea that we all want what's best for the students, for the kids. I hear that from the superintendents that we've had the chance to talk with. We might have different priorities and different perspectives, but I think we're all working toward the same thing. What can we do as researchers to make it easier for decision makers? What are you seeing on the ground that can lead us in the right direction in terms of what research questions to ask? So for all of that, I'm really grateful to have had this conversation with all of you.
Great. Okay, so now, Emily, I promised you that this was headed your way. So this is your chance. And I realize that this may be repeating some things that you've said before, but there'll be certain people that will only listen to a short snippet of what you've said here in the last 30 minutes. And so I want to give you the opportunity to summarize. Again, you're speaking to policymakers, whether that be a state legislator, a school board member, it may be parents, it may be whoever is looking at the 4-day school week. Based on the research that you've done about the 4-day school week, what are your findings that you would want people to strongly consider prior to adopting the 4-day week, or if they have adopted the 4-day week, to reflect on, again, looking through the lens of your research?
Certainly, yes. So like I had mentioned, really just keeping health as a focus when considering adoption. Looking what other places have done in terms of things like physical education, physical activity access. I mentioned just a little bit about, how can the school serve as that hub for physical activity for families? It intersects certainly a lot with sports and sports participation. And I think that's something that's really beautiful and special about smaller school communities that really plays into this 4-day school week in a positive way, that opportunity to have more time for physical activity. But taking all of those pieces together, thinking of the relationship between the family home environment and the school environment with regards to food provision, physical activity opportunities, childcare, all of those non-academic pieces, and making sure that that's a conversation that's ongoing with the family and the community. I think it's different everywhere, and it's so helpful to hear these stories. We've heard some really interesting things in our focus groups about ways communities have come together. Things like, in a community where it's totally normal for you to see kids at workplaces on Fridays because that's just the norm in their community, and that's a way they've kind of wrapped around their families, is it's okay to bring your kid with you to work, kind of thing. So keeping all of those health aspects, physical activity, diet, and sleep, I would say, are probably the main ones. And then some of those more economic related factors that certainly play into health, but food security and childcare are the ones that we've spent the most time talking about today, really just keeping that as part of the conversation.
Dr. Emily Tomayko of Montana State University, thank you for joining us in Missouri. We love to see you, and we appreciate your insight. It's going to help us be better at what we do in schools.